What we're going to be doing is the physical exam of the respiratory system and of the cardiac system. So first we're going to start off with inspection. So I'm just going to assess the skin for any color, texture, turgor, any moisture, lesions, scarring, nevus, or edema or bruising. I don't see any there. It looks good. Next thing we're going to do is just visualize the posterior portion, just for any deformities, anything that's really sticking out that looks not normal, and I don't see anything there. Next thing we're going to do is just inspect and palpate just the musculature of the back. So the shoulders, the spine, the scapula, everything looks good. No deformities there. Then we're going to assess for any, inspect for any respiratory distress, which includes any nasal flaring, which I do not see, any use of accessory muscles to breathe, any retractions, right, which I also do not see, any cyanosis, tachypnea, or tripoding. So I don't see any of that either. And the last point for inspection, what we're going to do is just assess for the breathing, right, which includes the depth, the rate, any the pattern, the rhythm, as well as any shortness of breath or wheezing, which none of that is noted in our patient. And so, yeah. So all that looks good and normal. So the next thing we're going to do is move into palpation. So Jorge, what I want you to do is just take a deep breath in for me. Good, and exhale. Good. Okay, so the chest rose and fell symmetrically, which is what we're looking for. And then for the last palpation, we're going to do tactile fremitus to just assess for vibration on the ulnar surface of my hand. So I want you to say 99 every time you feel my hands, okay?
99.
Mm-hmm.
99.
Mm-hmm.
99.
Mm-hmm.
99.
Excellent. Okay. So yeah, I felt the vibrations very clearly on the ulnar surfaces, which is good. Yeah, so now what we're going to do is move into auscultation. Okay, so we're going to auscultate all the lung sounds. So Jorge, just take a deep breath here. Laura, why don't you come on this side? Just take it, or no, Jorge, stay there. Face that way. Okay, thank you. Okay, so just to take a deep breath in for me. Good. 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 Excellent. Okay. And so yeah, all the lung sounds sounded very clear. No, rhonchi, wheezing, or any fluid that I could hear. And so now we're going to go through the egophony test. And so what I'm listening for in these next three tests is really, or the next two tests, the bronchophony and the egophony, is I should hear everything. It should be very muffled. I shouldn't hear anything clearly, because if we hear something clearly, that's an indicator for consolidation, which indicates fluid in the lungs. Okay? So Jorge, just say 99 for me.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Good. Okay, now I just want you to say E for me.
E.
A little bit longer.
E.
Mm-hmm.
E. 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 E.
Good. Okay, and And so, yeah, everything was super muffled, and I didn't hear anything that was egophony, and I didn't hear anything sounding like A, which is also indicative of consolidation. So that was also a good test. Now we're going to do the whisper pectoriliquy test. And so I shouldn't hear anything at all for this exam through the stethoscope, okay, for a normal finding. Okay, so just whisper
1, 2, 3.
a little quieter.
1, 2, 3.
Excellent. Okay, so auscultation, everything sounded really good. Now we're going to move towards percussion of the lung fields, okay? So I'm going to just percuss my third finger on the farthest digit here, okay? It should be very tympanic and resonant. Good. Okay, so yeah, that all sounded good. And so now what we're going to do is test for excursion. So now, okay, so what I'm going to do is, you need to grab this. I'm going to percuss. You might want to come over here for this. Just come on this side. Okay, great. So Jorge, what I want you to do is take a really deep breath in for me and hold, okay? Deep breath in. Good, hold. Good, okay, so that's where the resonance stops. You can exhale. Okay, breathe out. Okay, so I left a mark where the resonance stops for the percussion, okay? Now I'm gonna have you take another deep breath in for me. Good, and then I'm gonna percuss up. Good, okay, so about right there. Perfect, okay, you can breathe in, okay. So then what I would do is measure that distance between the 2 points, and that would give us our excursion and a normal finding. It looks about 4 centimeters with my pretend ruler, and that is a normal finding, okay? So yeah, that is all the percussion. So now, Jorge, if you can just turn around for me, we're gonna do the anterior chest, okay? So for this part, I'm once again gonna assess the skin for color, texture, turgor temperature, any edema, lesions, moisture, scarring, or nevi. I don't see any there. I'm also just gonna inspect for any visual deformities. Again, I don't see any of the chest. I'm gonna palpate. So once again, take a deep breath in for me. Good, and then out. Good, okay, so everything was symmetrical. Now we're gonna do tactile fremitus. So just say 99.
99, 99, 99, 99, 99.
Good, okay, so that was good. I felt the fremitus and the ulnar surface. Okay, now we're just gonna auscultate. Okay, just take a deep breath, a quick breath in and out. Good. 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 Okay, so the lung sounds all sounded very clear, which is good. Okay. Yeah, nothing to percuss. So, okay, so now what we're going to do is move into the cardiac portion of the exam. So what I'm going to do is begin to oscillate the lung sounds. The 5 points that we're gonna be listening to are the apical, the pulmonic, the Erb's point, tricuspid, and the mitral valve. And so what I'm going to do is listen with the diaphragm and then the bell on my stethoscope. And I'm listening for any like regurgitation or any abnormal findings in the blood flow through auscultation. So I'm just going to go ahead and do those 5 points. You might want to come here just so. That was apical, pulmonic, Erb's point, tricuspid, so apical would be here, pulmonic, Erb's point, tricuspid, mitral. Okay, good. So no signs of any abnormalities. Do the same thing with the bell. Good. Okay, so everything sounded normal, which was good. Okay, now I'm going to feel for the point of maximum impulse, and I will auscultate it when I'm finished. We're going for the 5th intercostal space, mid-clavicular. Good. Okay. All right, and now what I would do is auscultate it for rate and rhythm. Good. Okay. And something I also forgot to do with the lung fields was to just auscultate the lateral lung field. So I'm going to go ahead and do that now. Just take a deep breath in for me. Good. Good. On the right side, I'm going to hit the 3 lobes. The middle lobe is important as well. Deep breath in. Here, Laura, come on this side. You need to see where the stethoscope is. Take a deep breath in. Good. 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 Okay. All right. Okay, so now we're going to do the exam on the couch. So we're going to just come to the couch for me. Okay. All right, and lay down, relax. Okay. So, first thing I'm gonna have you do, I'm gonna listen to the 5 sounds of the heart. So again, the apical, pulmonic, Erb's point, tricuspid, and mitral in order with the diaphragm and then the bell. Okay. Erb's point, tricuspid, mitral. Okay, same thing using the bell. Good. Okay, so I didn't hear any abnormalities there. And before I would auscultate, I would inspect for any lifts or heaves. And now what I'm going to do is palpate for any thrills. So I'm going to use this part of my hand for the palpation. And that palpation just could indicate maybe, like turbulent blood flow or anything like that, okay? So And I'm going to do this for the 5 points that I just described. So apical, pulmonic, point, tricuspid, mitral. Okay, so everything, I didn't feel any abnormalities there, no thrills. Okay, so now we're going to assess for just the jugular vein. So Jorge, just look out the window for me. Okay, and I'm looking right in this spot right here, and I should just see kind of like a lub, like a little fluttering, and we can actually see it right there. Okay, which is good, is a normal finding. Yeah, so did you get where my hand is? Okay, yeah, so that looks good. Yeah, what we don't want to see is any like distension, right? I don't see any distension with that. And so, yeah, I think, so then what I'm going to have you do is just sit up for me, like put your feet right there for me. Okay. And now what I'm going to do is I'm going to auscultate for any regurgitation. Okay. So any mitral valve regurgitation. Okay, so lean forward for me, Jorge. Good. 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 Okay. So no regurgitation. So now what I'm going to do is just palpate for the point of maximum impulse. So Jorge, just put your head right there for me and lay on your side. Okay. And I'm just going to palpate. Thank you. Okay. Right here. You're good. Good. Okay, good. So that felt good. I noted the rate. We'll just say it was, about 15 beats in about 15 seconds, so 60 beats per minute. Yeah, and so that concludes our assessment.